Um, so also according to the California Career Zone, you need to be able to um, monitor yourself, have quality control analysis,
Mm-hmm.
active listening, operation monitoring, and critical thinking. Would you think?
Absolutely.
Do you have any other suggestions?
This job is very much so about communication. Um, it very much so is because the doctors have a certain expectation of when things get done. And anything that anyone knows about surgeons are they're very proficient at their job. So they expect the same professionalism, they expect the same high quality work from you. So critical thinking is very important because there are different avenues that you can take to obtain this sterilization. But you have to kind of think about what is best and what is going to be the most efficient in providing the best patient care outcome possible, because that's what it's all about. It's all about patient outcome.
All right. Well, do you think the job is very demanding, or would you think it's more relaxed?
Oh no, this job is very demanding. uh, they do first cases every single day, 24 operating rooms at 7:30 in the morning every day. It does not end. Monday through Friday at least. Weekends, they deal more with transplants. But Monday through Friday, every single operating room, 24 rooms with the exception of one of them. We don't have an OR 13, but anyone who knows anything about hospitals knows you never have an OR 13. I don't know why. um, but the 24 rooms, plus the procedure rooms and the cath labs, they all start at 7:30. So everything needs to be done and ready by 7 a.m. Which is why I get there at 3. Just to make sure that those first cases run smooth. Then there's a turnover period. Once they wheel out a patient, they have about a 45-minute period where the hospital assistants clean up and turn over the rooms. Any blood or any disposable items, the bed, the patient, everything wheels in to wheels out. There's about a 45-minute period. So things for second cases, things for third cases, all of those things need to be ready to go far in advance of what time. And really that depends on how fast the surgeon is. The surgeon's faster, it's going to take him less time. You need to make sure that these things are done, which is why when I serve as the OR liaison, uh, it is very much so a time sensitive job. You definitely need to be on your P's and Q's and be aware of what's going on. There's a board that lets you know, hey, this patient's in facility and, they're having this part of the surgery, they're done with this part, they're going to be wheeling out soon and wheeling in another patient. It's all about patient care, but it's a hospital, so it's about profit as well. So a big part of them being able to do their job is me doing mine well.
All right. Well, below you, we have a few things on the table. Would you mind describing the piece of clothing right here, please?
So the this is the department issued scrubs that we wear, and the scrubs are wash and laundered through the hospital. You come in your street clothes, kind of like I am now, and you get your scrubs out of a Pyxis machine. At the end of the day, you return your scrubs there, and they're hospital laundered because you work in infection control and you are exposed to, the blood and the really infected parts of a person's body. This is, there a lot of times is open cavity. So everything is laundered at the hospital. The scrubs sort of look like these. And depending on what side you work on, whether you work on the clean side, as I spoke about before it goes to decontamination, when you're in decontamination, you would wear what's called PPE. And we don't have examples of that here, but kind of what the gloves are. But it's full PPE. So from head to toe, you are covered. You're basically in a bunny suit. And that includes a face shield and a mask and a scrub cap. And you're double gloved. and you have shoe covers. Basically, your entire body is covered because in that area, you will be exposed to blood. You will be washing at the sink. I don't typically work in that department, that sector of the department that often. I'm typically just back there looking for things for them, for the technicians back there to prioritize. But the instrumentation does arrive to the department being used after surgery, bloody, gory, umbilical cord still connected, the whole nine. It's quite gross. It can be, but I don't work back there a whole lot. Maybe once in a blue moon, once every 6 months, I have to go back there and actually work if we have, a number of call outs, meaning people not showing up for work. But that's kind of where that goes. This is in life really, but in particular in my job, hand hygiene is very important in order to provide a sterile product. A big part of it is making sure that our hands are clean and that we're not exposing the patient to anything that we may be carrying, whether it be the flu or just making sure that our hands are clean when we're handling instrumentation such as these, on the clean side. So PPE and decontamination, and that's personal protective equipment. That's for their safety, for the technician's safety. The scrubs that are laundered at the hospital by infection control, and hand hygiene.
All right. So, can you describe some of these instruments down here, please?
Oh, okay. So, this instrumentation here, these are what's called operating scissors, and they're typically used in plastic surgeries and head and neck surgeries. They're very precise and finite scissors, so they have a very, very finite tip if you notice. These are straight Metzenbaum scissors. They are typically used for cutting tissue. This is a needle holder, and that's typically used in order for them to suture. They used to do it by hand, but now they'll use more of a needle holder in order to do that. And these are bandage scissors, just cutting bandage. Typically they'll use that if they're reopening a wound or re-inspecting a wound. So those are just some of the instrumentation on loan to me from the hospital. Yeah, those are pretty much it. And those are some standard instrumentation. Some of it is very complex. Some of it is power equipment and things that they'll use in what's called intuitive surgeries, which is robotic surgery. And some of it is more power equipment, sternum saws that they'll use in order to crack open the sternum, crack the chest open in order to expose the heart and the lungs and all of that. And but there's some very simple instrumentation such as this, and there's some very complex instrumentation like what they use in robotic surgeries and major orthopedic surgeries and so on and so forth, face transplants and things of that nature.
And right here, could you tell us what these papers are, please?
Oh, so you have a copy of my certification. This is a bad copy, but this is a copy of the certification, and this here is just saying that I've completed the program, and I did this back in 2015. Completed the program in order to receive my certification. So that's a little bit of that.
All right. Well, thank you for giving us your time today. Can you state your name and your occupation one last time for us, please?
Again, my name is Monisha Clayton. I serve as sterile processing OR liaison at Ronald Reagan UCLA Westwood. I've been there about 4 years.
All right. Thank you.